Hello, welcome to the channel.
Occupational
Let's
English
practice the
test.
listening test.
Listening
And if you
test.
practice the more and more,
This
then
test has three
after you can
parts.
build your skill.
In each part, you'll hear
The
a number
skill
of
could be
different
built
extracts.
only through the practice.
At the
There
start
is
of
no
each
any other
extract,
way
you'll hear this
instead of
sound.
this. Let's practice.
You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, David. It's good to see you.
Hello, doctor. I'm a bit nervous about today.
There's no need to be. I understand you recently underwent a kidney transplant.
Yes, it was about 3 weeks ago. I wanted to discuss the aftercare and any lifestyle changes I might need.
Of course, your transplant surgeon, Dr. Stonebridge, has shared your records with me, and it seems the surgery went well.
I'm grateful for that.
Before diving into the post-surgery care, can I get some basic information from you?
Sure thing.
Can you tell me your age, please?
I'm 47 years old.
And your place of birth?
Originally from Brazil, but I've been here for over 20 years.
Marital status?
Married with 2 kids.
Lovely. And your current address, are you living in a house or an apartment?
In a house, with a small garden at the back.
That's nice. Do you work or are you currently taking a break?
I've taken some time off work. I'm an architect.
Sounds demanding. You must be eager to get back to work.
Yes, but I want to ensure my health comes first.
Absolutely. Now, any known allergies or past surgeries?
I'm allergic to penicillin. I had an appendectomy when I was 19.
Noted. And your weight and height?
I weigh around 82 kilos and I'm 175 centimeters tall.
Thank you. Regarding the transplant, are you on any specific medications?
Yes, I've been prescribed immunosuppressants to prevent rejection of the new kidney.
It's essential to take those regularly. Also, how's your water intake? Keeping hydrated is crucial now.
I'm drinking at least 3 liters a day.
Excellent. And diet? Keeping low sodium.
Yes, trying my best to eat clean and reduce salt.
Good, and remember to avoid any strenuous activity or heavy lifting for now. Gentle exercises like walking will help though.
Understood.
There's a patient support group for transplant recipients at our Unity Health Center. They offer advice, support, and share experiences. It might be beneficial for you.
That sounds great. I'll look into it. Thank you, doctor.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello Jane, I'm Dr. Mason, one of the chiropractors at this clinic.
Hi Dr. Mason.
What seems to be troubling you today?
I've been feeling this constant stiffness in my neck and sometimes there's a sharp pain when I turn my head to the right.
I see. How long have you been experiencing this?
About a couple of months now. Initially, it felt like I just slept wrong, but it's been persisting and the sharp pain started just a few weeks ago.
Got it. Did anything particular happen around the time it started, like an injury or accident?
Not really. I did start a new desk job around that time though, and I've been on the computer a lot.
Ah, that could be a contributing factor. Can you describe the sharp pain a bit more?
Yes, whenever I try to look over my right shoulder or tilt my head to the right, it's like a sudden jolt of pain that stops me.
Understood. And is there any other symptom associated with this? Like a headache or dizziness?
I do get headaches occasionally, mostly by the end of the day.
Alright. Now, if we look at our posture chart here, you mentioned stiffness primarily in the neck area. And sharp pain when turning to the right.
That's right.
Is there any discomfort between your shoulder blades or in the upper back?
Sometimes, especially after long hours at the desk. It feels sore.
Noted. No issues turning your head to the left or looking up and down?
No, just the right side.
Okay. And the right shoulder is okay? Any pain there?
No, the shoulder seems fine.
Great, thanks for clarifying. Last question euro, any tingling or numbness down your arms or fingers?
No, nothing like that.
Alright, that's helpful information. Let's get started on some tests and see if we can identify the root cause.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Okay, quick rundown for you. Mr. Jacobs is a 72-year-old male who came in with acute shortness of breath. He has a history of COPD but no other known allergies. Vital signs are a bit on the low side today, especially the oxygen saturation which occasionally drops below 90%. We've given him 2 liters of O2 via nasal cannula. Last check was at 7 o'clock. He'll need another saturation check by 9 o'clock. He's on a pureed diet, but really showing poor appetite. As soon as he's stable, we're thinking of initiating nebulizer treatments. No bowel movements since admission, and he's currently on 4 fluids, 0.9% saline at 75 milliliters per hour. We've also applied a pulse oximeter to monitor continuously. Foley is in place. That's the snapshot. Anything else you'd like to know?
Is he on any bronchodilators?
Yes, he's been prescribed albuterol. It's given via nebulization every 4 hours, last given at 6:45. Should be up for another by 10:45.
Now look at question 26.
Mrs. Mitchell, how would you rate your headache on a scale from 0 to 10, with 10 being the worst pain imaginable?
I say it's an 8. Really intense behind my eyes.
An 8, got it. She's been NPO since midnight.
Any scans or tests done yet?
Yes, she had a CT scan earlier, which was clear, thankfully. However, due to the intensity and sudden onset of the headache, we've ordered a lumbar puncture to rule out any possible concerns. In the meantime, she's been given 10 milligrams of Toradol 4 for the headache. Last dose was given at 7:15. The next one, if needed, can be given after 11:15. We've also dimmed the lights in the room to make her more comfortable. She's also got a cold pack on her forehead which seems to help a bit.
Thank you. We appreciate the care.
Now look at question 27.
You mentioned your nausea level is around 6, and your next anti-nausea medication isn't until 9:45. What I'll do after I finish checking on my other patients is to review any additional orders from the doctor. Sometimes, physicians prescribe multiple types of anti-nausea meds that can be given simultaneously. Besides the ondansetron you're currently on, there may be something else available. One non-medication method to combat nausea is deep breathing and sometimes certain aromatherapy, like ginger or peppermint. These can help soothe the stomach. Additionally, while it might sound strange, sipping on cold water or sucking ice chips sometimes alleviates the sensation. We can try to get you some ice chips for now. Would that be all right?
Yes, I'll give it a try. Anything to reduce this feeling.
Now look at question 28.
Ideally, we want to ensure you feel seen and cared for without needing to summon us constantly. One way we attempt to provide proactive care is by doing regular check-ins, either by a nurse or a patient support assistant. This ensures you're comfortable and reduces the need for the call button. When you press that blue button, it alerts our central station, and someone will promptly address your needs. Does that process make sense?
Yes, that's clear. So I just press the button if I really need something, right?
Exactly. I'll also make sure our board here has the current shift's contact details. We believe that patients are more at ease when they are informed, so we make an effort to consistently update our info board. It's a point of reference for you, so you know who's looking after you and how to reach out if you have any concerns. Your comfort and safety are our top priorities.
Now look at question 29.
The practice of individualized care plans and patient participation isn't just a routine. It's the backbone of patient-centered care. When patients are active participants in their care, they have better outcomes, feel more empowered, and have greater satisfaction with the care they receive. Our core principles of empathy, diligence, transparency, unity, and professionalism shine through when we involve our patients in every step of their healing journey. Every interaction is approached with genuine concern, a listening ear, and a commitment to the well-being of those we serve.
Now look at question 30.
The multidisciplinary team meeting, often referred to as MDTM, is a cornerstone in ensuring comprehensive care. Not only does it allow various specialists to come together and discuss the holistic care of a patient, but it also involves the patient in decision-making. In these meetings, each specialist shares their expertise in front of the patient, giving them a complete understanding of their health status. When patients are present, it paves the way for open dialogue. This setting allows the patient to voice their concerns, understand the proposed care plan, and even provide insights into their preferences and values. It's not just about what we believe is best medically, but also understanding what's best for the patient from their perspective. What are their fears, hopes, and priorities? By addressing these, we ensure a tailored approach to healing, keeping the patient's well-being at the forefront.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Today, I'll be giving a comprehensive overview of the incidence and identification of neurodevelopmental disorders in British children. Neurodevelopmental disorders are a group of conditions with onset in the developmental period, often before the child begins formal schooling. They may manifest as difficulties related to personal, social, academic, or occupational functioning. It's worth noting that genetics plays a significant role in neurodevelopmental disorders. If a parent has a condition such as autism spectrum disorder, ASD, or attention deficit/hyperactivity disorder, ADHD, the likelihood of their child being diagnosed with a similar condition increases. Environmental factors also come into play. For instance, maternal alcohol or drug use during pregnancy can heighten the risk of disorders like fetal alcohol spectrum disorder, FASD. Infections during pregnancy, premature birth, and traumatic births are other risk factors to consider. In the UK, health screenings for newborns and toddlers are routinely conducted to detect any anomalies early. For instance, the Red Book, or the Personal Child Health Record, keeps track of a child's health, growth, and developmental milestones. Despite this thorough approach, there are challenges in detecting neurodevelopmental disorders early on. Recent data reveals that nearly 97% of British children undergo developmental review at 2 years of age. However, disorders like ADHD and ASD often remain undiagnosed until school age or later, even though early symptoms might be present. The school environment often brings out challenges for children with neurodevelopmental issues. Teachers and peers become more aware of behaviors or skills that deviate from the norm. In the UK, it's estimated that about 5% of children show symptoms of ADHD, but only around 3% are diagnosed and receive treatment. The discrepancy underscores the importance of better diagnostic protocols and awareness. It's crucial to understand why these disorders don't manifest prominently early on. Neurodevelopmental disorders, by nature, involve complex brain functions. During infancy and toddlerhood, many brain pathways are still forming and refining. Thus, certain impairments only become evident as the brain matures and more complex cognitive and social demands are placed on the child. Considering the intricacies of the brain, MRI and other imaging tools have become valuable. Yet, these tools are not widespread in every healthcare facility, especially in rural or underserved areas. The gold standard for diagnosing disorders like autism remains a comprehensive assessment by a multidisciplinary team, often found in specialized centers like the Great Ormond Street Hospital. Therefore, while waiting for a definitive diagnosis, healthcare providers, educators, and parents must rely on observed behaviors and patterns. Comparing a child's behavior with standard developmental milestones can offer insights. To sum up, the UK has made significant strides in the early detection and management of neurodevelopmental disorders in children. However, the complexities of these disorders, coupled with the intricacies of brain development, present ongoing challenges. Increased awareness, enhanced training for primary care providers, and improved access to specialized care are vital steps in ensuring every child receives the support they deserve. Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Chronic heart disease, CHD, is alarmingly prevalent among the Maori population of New Zealand. With staggering statistics, the Maori community faces a CHD rate that's almost twice as high as the non-Maori inhabitants of the country. Estimates indicate that nearly 20% of Maori adults suffer from CHD, a rate significantly higher than the national average. When it comes to heart failure, Maori individuals are disproportionately represented, making up about 16% of New Zealand's total population but accounting for 30% of heart failure cases. Unmanaged heart disease increases the risk of stroke. The Maori population experiences a higher rate of strokes compared to non-Maori New Zealanders. A pivotal precursor to CHD, hypertension is notably prevalent among the Maori, with genetic and environmental factors contributing to this predisposition. Maori men and women face an increased risk of heart attack due to untreated or undermanaged heart disease. Studies suggest the Maori may possess genes that heighten the risk of heart-related ailments. This genetic predisposition, combined with modern lifestyle challenges, can lead to a higher incidence of CHD. Modern diets, high in saturated fats, processed foods, and low in essential nutrients, have adversely impacted the Maori community. Traditional Maori diets were rich in fresh produce and lean proteins. Similar to the Aboriginal community in Australia, a significant portion of the Maori population battles obesity, a leading risk factor for CHD. Central obesity, or fat stored around the abdomen, is of particular concern. The shift from active, outdoors-based lifestyles to sedentary urban living is a major contributor to the rising CHD rates among the Maori. Despite New Zealand's robust healthcare system, disparities in access and healthcare outcomes for Maori individuals persist. Cultural barriers, socioeconomic challenges, and geographical remoteness can restrict their access to quality care. Smoking rates are higher in the Maori community compared to non-Maori groups, adding to the CHD risk. Addressing the CHD crisis among the Maori requires comprehensive interventions. Culturally sensitive health promotion, improved access to early detection and treatment, and community-based initiatives promoting healthier lifestyles can pave the way for better heart health for the Maori. The Maori population's vulnerability to CHD is a complex issue shaped by genetics, lifestyle, and socioeconomic factors. Drawing parallels to the health challenges faced by the Aboriginal and Torres Strait Islander Australians, it underscores the importance of culturally appropriate interventions in healthcare.